Hello everyone, are you ready to take control of your health journey but overwhelmed by all the information out there? Welcome to Wellness Insight. I am Beena Das and a registered nurse of over an years of experience. My mission is to provide you with clear evidence-based health and awareness content. On this channel, we break down complex topics like gut health, mindful nutrition and disease prevention into simple, actionable steps. If you are looking for reliable information to live a healthier, more vibrant life, you are in the right place. Be sure to subscribe and hit that notification bell so you never miss an update. Thanks for joining me and let's start this journey together. So we are going to talk about the PCOD. So now PCOD is the hormonal disorder and it stands for polycystic ovarian disease. So here we are going to start with an introduction. So PCOD or polycystic ovarian disease is a common hormonal disorder which mainly affects in women of reproductive age that cause ovaries to produce excess androgen. And androgen is an male hormones which highly produces excess amount and immature or partially mature eggs which can develop a cyst. So here is an image. The normal ovary is look like with the less macules, and polycystic ovary is consist of lots of macules, redness. Then we see causes and contribution factors, which are all the factors that contribute this disease. First, we will see hormonal imbalance. So the primary cause is an overproduction of androgen by the ovaries, which can disrupt the menstrual cycle. As you all know, the primary cause is the main that the hormone, which is androgen, that is male hormone, which secrete in excess amount by the ovaries that can disrupt the menstrual cycle in the women. Next cause is genetics and lifestyle. PCOD is influenced by both the genetic tendencies and lifestyle factors like poor diet, lack of physical activity, and stress. As you all know, many of the doctors are here who share their information and they basically emphasize on the topic. If a woman is changes his lifestyle in a sedentary way, then it can lead to a polycystic ovarian disease. So this is the main cause. The next cause is insulin resistance. High levels of insulin can cause the ovaries to produce more androgens, contributing to the development of the condition. So insulin resistance, the more insulin, the more chance of secretion of androgen, which is male hormone, that can lead to a PCOD or PCOS condition. So here are some symptoms which we see both condition, either it is as PCOD or PCOS. So in PCOD, there is a common symptom we will see, that is menstrual irregularity. Then excess hair growth on the face and the body. Then hair thinning, darkness of skin, where skin creases, red is neck, armpits and groin region you can see. Then there is one more, the main symptom we can see, heavy bleeding when periods do occur, severe obesity and acne. These are the symptoms which we can see in PCOD patient. Then next we are going to see PCOS symptoms, which similarly same as PCOD. So here first is headache, hirsutism, acne, weight gain, darkness of skin, male pattern, baldness, irregular period. These are the common symptoms. Okay, next we will see the management of lifestyle for PCOS and PCOD. First, we have to talk about the diet pattern. So in diet pattern, which is directly involved in the maintenance of body weight. So the normal BMR, body mass rate for healthy female range from 18.5 to 24.9. That is the main important BMR range for the females. Then physical activity. Physical activity reduces body fat and keeps you active throughout the day. So doctors suggest for the women who suffers from the PCOD or PCOS, they have to do some physical activity so that it will reduce the insulin resistance cause or change the lifestyle and reduces the chance of the sedentary lifestyle to overcome from that situation. The next is sleeping habits. Beside eating habits, sleeping habit need to be observed to maintain a healthy weight. Okay, this is the very much important management of lifestyle. We have to keen observation how our sleeping habits or pattern is there. So we need to change if there is something lacking. We need to sleep approximately 7 to 8 hours. Then next is alcohol and cigarette. Alcohol and cigarette consumption will increase the production of androgen. So now I'm going to differentiate between the PCOD and PCOS. So here are some aspects. So type, PCOD is an hormonal disorder and PCOS is endocrine plus metabolic disorder, which mainly cause our metabolic system also. Then egg release. In PCOD, immature eggs are released while ovulation often stops in PCOS condition. Severity. In PCOD, milder, more common, and while PCOS more serious and less common. Fertility often unaffected in PCOD condition, and in PCOS condition, fertility can affect or impact the ovulation process. Then long-term risk. There is a low risk in the term as long-term risk. We can see in PCOD is in very low, while PCOS it is long-term risk is for diabetes or heart disease. Then symptoms. As we also see in the images in the form of symptoms, that irregular periods, acne, weight is more common in PCOD condition and similar but more severe in PCOS condition. Okay, thank you for this supporting and never miss an update. Hit the bell icon